Good afternoon, everybody. We're just letting everybody into the webinar and then we'll shortly be starting. Okay. Thank you, everybody, for joining. Just waiting for the last few people to join the webinar and then we'll get going. Wonderful. It's a couple of minutes past now, so we'll get started with the webinar today. So thank you everybody for joining. Today we're going to have the SHOT Transfusion Safety Standards webinar from paper to practice. Thank you for joining the Teams meeting. We've got no camera activity and no microphone for the panel, not for the panelists, sorry, for the participants today, so you'll remain muted. We also don't have the chat facility, so if you've got any questions, please put them in the Q&A box there and we will answer those at the end of the session. If you need live captioning, instructions are shown how to enable that, and we'll also be having a recording of this webinar available on the SHOT website in the coming week following the webinar. There'll be no certificates from the webinar, but we're encouraging participants to record CPD. Lovely. Thank you very much. So the panelists for the webinar today, we're going to have a main presentation from Dr. Shruthi Narayan and with input from Nicola Swarbrick. We're then going to pass on to our lovely representatives that have joined us from the UK nations today, and they're going to share their experiences. So I'll just leave those there for a second for everybody to be appropriately acknowledged, and thank you for joining us today. Lovely. So we'll go through the outline of the webinar today. So as we've mentioned, we're going to have an overview of the SHOT Transfusion Safety Standards, how they're implemented and what the reasoning behind them were. We're going to signpost some relevant resources, things that SHOT have produced and external resources that may be of help to you. We're going to have updates from some representatives from the 4 UK nations of their experience of implementing the safety standards so far, what they've achieved and what their other experiences are, and then we'll have about 15 minutes at the end for your questions and answers. But at any point you want to put a question in the question function, please feel free and we'll address those appropriately. So I'm going to pass over to Shruthi now to start the main presentation. Thank you.
Wonderful. Thanks very much, Vicky, and thank you all for joining the webinar today, and look forward to actually addressing all the questions as well. And as Vicky mentioned, over the next few minutes, I would be covering the rationale. Why did we actually then release and produce the standards? What is the overview of the standards? Also, actually, the list of the supporting resources that are available, and also a few key points about implementation and monitoring. So why did we actually produce the standards? Now, all of you would have actually now seen the highlights from the latest annual SHOT report, but also actually are with us when we actually say there is a concerning rise in the errors that are actually continuing to account for more than 80% of the reports in the recent years. A significant rise in the transfusion-related deaths of all imputabilities. Now, although thankfully we did not have anything with definite imputability, we see continuing rise with the deaths due to TACO as well as the delayed transfusions. And as I've said, it's not just the deaths, but also the total number of delayed transfusions are on the rise. And this is actually despite the safety alert that was issued recently. We've also seen the increase in the TACO deaths, the increase in the laboratory errors as well. So whatever we have so far is not really working, and therefore what differently can we actually then do now? Now, Infected Blood Inquiry came out with the report in May 2024, and that is a comprehensive report that details the circumstances, that led to the tragic deaths and the continued suffering. But many of the recommendations that came from the Infected Blood Inquiry supports patient blood management, hemovigilance, transfusion education, laboratory support, and digital transformation, and everything, really closely aligned with the priorities that we have identified, as well as the recommendations that came in the recent SHOT reports. But also one of the recommendations from the Infected Blood Inquiry was to have a mechanism for implementation of the SHOT recommendation, as well as having some oversight for monitoring the compliance as well. But there were other additional drivers as well to consider for producing the transfusion safety standards. Now, many of you may be familiar with the Healthcare Safety Services Investigation Branch report that came out in September 2024 that actually covers that recommendations but no action. So when we look at the healthcare and the multiple number of recommendations coming following different reviews, inquiries, etc., how is the way that we can rationalize all these recommendations and improving the effectiveness of the quality and safety and the implementation? We've also seen, this is especially in England when we've seen the Darcy report, the long-term plan. It actually talks about how do we, with that mixed quality of care, how do we actually centralize the safety discussions, simplify, and actually rationalize what we are actually then throwing at our frontline teams as well. But also, it is actually acknowledgement of what we are hearing from all of you as the members in the transfusion community. Now, with our serial annual surveys, we have had that feedback from the clinical and laboratory staff, and insights from those recommendation survey says that with every report we were bringing out the recommendations, that is always a moving goalpost. By the time you're actually then having a tangible plan for improvement, then there is another report and another annual recommendations. But when we looked at the themes in the 25th year celebrations, the themes were really the same in all the serial annual SHOT reports, with respect to staffing, staff safety, IT, education, and the staff culture, the safety culture, as well as the leadership. So therefore, looking at all of these, then we really wanted to actually then provide what would be a stable framework and what are the essential requirements for safe transfusions in the UK. And that is actually the reason why we led to the development of the transfusion safety standards. Now, when we look at these standards, and I'm sure that many of you would have actually already had a look at this. So this is how the document, and we have provided these standards both in a variety of forms. It is in the HTML, in the Word format, as well as the PDF format. Now, this highlights all the different 8. What we then did was actually then categorize, and this covers both clinical as well as the laboratory aspects. And this is actually in the top 8 categories, 8 standards that we have. Now, this is the QR code for those who may not have actually then gone through, but really we need to look at these standards as the catalysts for safer, stronger transfusion practice. But it's also intended that it is protecting the people behind the practice. It is that aim of driving the continuous improvement, safety, and resilience across the healthcare. Now, these replace the SHOT recommendations. So I'll cover in a later bit about what are the changes that we have seen in the report, but you would have seen in the 2024 annual SHOT report, these replace the standards. The only recommendation is actually mapping out your compliance as well as having an improvement plan towards these recommendations. Now, how have we laid out and how the standards have been presented? So we have that overarching standard, those 8 things in those categories, and I have the next slide that cover that. But we've also explained what is the intention for the standard. Why was it actually then also included there? And under each of these, we also actually then have several requirements as well as the criteria. Now, it is comprehensive, and it is actually covering all the different aspects that are really vital for transfusion safety. So a quick overview about what the high-level standards are. So the first one I said about the safety, and this is, all of these are really commonsensical and basic requirements. So we're saying here all transfusions must prioritize patient safety, and that should also show compliance with the clinical guidance as well as the regulatory requirements. The next one is actually about IT systems as well as the equipment, and which is really so integral for our day-to-day transfusion practice. So we have said that all IT systems and equipment must support this safe vein-to-vein transfusion practice. They should be configured, validated, implemented, and the functionality should also be optimally used. But the next thing comes about the staffing numbers. And we know that the recurring theme in our reports is with respect to the mismatch with respect to the workload. So this is actually focusing on staff. So how do we have, that impetus for the trained and supported staff who can then deliver safe transfusions. But also you would have noticed that it is prioritizing staff well-being as well as professional development. And it's also placing the onus on the system. So the healthcare, the leaders and the organizations should ensure that all staff are trained. They have access to the appropriate development opportunities to support that systems approach for safe transfusion practice. And then about the safety culture. Now, the UKTLC survey as well from a couple of years ago highlighted the problems that we have in the laboratory safety culture. And we know from the anecdotal reports as well, that's also the problem with even the clinical teams. And therefore, it is actually embedding that requirement for a just restorative learning safety culture that has to be actually promoted widely, but also about moving towards involving and partnering with patients for safety, where we are saying it is not just, and this was a recommendation in the 21 annual SHOT report. And so here we are saying about moving to that shared decision making, safer transfusions, and involving them at every stage, not just in their own care, but also in aspects of organizational safety. The other thing is about how do we ensure learning from all the things related to the transfusion. So how are we implementing that? Effective improvement actions, near misses as well are actually then learned from in this, and also having that holistic approach. And the last one is actually about governance system. How do we integrate the discussions of the transfusion safety into the wider patient safety discussions, ensuring that the transfusion governance system are effective within the hospital with adequate oversight as well. Now, this is a busy slide, but this is actually just to show you all the 8 high level, and you can all agree with me that these are really vital to ensure safe transfusions in the hospital. Now, how were the standards developed? This is covering the timeline for the development of the standards. As you know, we were mulling over what can we do better from the recommendations angle. The infected blood inquiry report came out in May 2024, and we started having those initial discussions within SHOT. And the first draft of the standards was actually then produced in early 2025. Now, if we see the first draft that was actually sent to the SHOT steering group and working expert group, it was completely different to what you have actually then seen. So that actually shows the different versions and the changes that actually then came in. Following input from the SHOT steering group and working expert group, they were then updated. And this was actually then sent, to a wide range of stakeholders across the UK. And many of you may have also actually received and provided input and received kind of more than 100, feedback. And this was both individual as well as teams providing feedback together. And this was actually circulated through different groups, and both within transfusion, within the various IBI subgroups as well. So it was really extensive, but it was an accelerated. It was in a short span of time that we had done that as well. And therefore, following that feedback, we then further refined and then released the standards in July 2025. But the work does not stop with just the release of the standards. So what we also then did, and also one thing I forgot, is the standards were not just based on the annual SHOT recommendations. I have a slide about that later, but also looking at what are the key recommendations in the recent times that are related to any other patient safety issues as well. So from that release, also what we realized is that we need to really provide a lot of supporting resources as well. So we provided a baseline assessment tool in July. We've also produced, some of the a document which signposts the available resources and as well as the tools, both from within SHOT as well as what is available across the NHS. And this is the webinar that we have actually planned. We are also planning to actually then map it to the existing standards as well as the other guidance that is available. And if there are any questions that have been identified that are not covered in the frequently asked questions, we would like to actually update, and that is a dynamic document. So if we see that that is something that is not updated, we could do that. We're planning to have another webinar as well to actually see the progress. Now, whether it's going to be in Jan or a little later, because I know that we really would like to hear how people are progressing with the implementation across, and we would aim to have a session at our next symposium, so watch this space. and how these documents and the various supporting documents on our website. Now there are, and Nikki is going to show that, so I'm going to just cover this quickly here. And we have all these different image styles. The background to the standards, all that I actually described as to why we went through with releasing the standards, is actually in the scope. We also then have the standards that are actually covered, and then we have the toolkit. So in that scope is the why, what, who. And then we have the actual standards where I said that the document is available in the content is available in different versions. And then we have the toolkit where we have all the supporting resources such as the timeline, the baseline assessment, the frequently asked questions, and the relevant resources. Now, the safety standards, when they were released, the RCPAT fully endorsed the SHOT Transfusion Standards, and to the left there, you can actually see the letter that went out from as a note from the president. The IBMS also actually endorsed the SHOT Safety Standards, and so did a variety of organizations. So this is actually, giving the list of all the different organizations that endorsed and welcomed this SHOT Safety Standards. So we have all the national transfusion committees from across the UK, the British Society for Hematology. Also, we have UK NECWAS and the BBTS as well. They have endorsed these standards. And there was some coverage internationally as well. So this is just an example where Australia picked up, and also they were then saying about what are the benefits for the transfusion laboratories from the safety standards as well. So really, it is actually talking to those essential principles for supporting safe transfusions. And the big question is actually, okay, the standards have been released, there are supporting resources, but what next? And the big question is about that implementation and monitoring. Now, the baseline assessment tool has been actually released, and I'm aware that this is actually, a template that we have actually given. It covers all the different standards, so in each of the different tabs, but we have provided this more as a template that people can actually then use and adapt depending on the local requirements. And it is a starting point. So it is actually then telling people, and remember, these are based on the previous SHOT recommendations. So nobody's starting on a blank page, because you would have had some improvement activities and progress with the previous SHOT recommendations as well. So you're analyzing what is actually the current status and what are the actions that are actually then necessary. So after you identify the gaps, what are the challenges, and therefore what are all your tangible plans and the future plans, and what are your target dates as well. But what we are really hoping, and this may vary across and differs from hospital to hospital in this implementation journey, and any improvement begins with that understanding. And that can be the difficult process, and that can be the tedious process. Understanding what are the systems, what are the gaps, what are the behaviors and the decisions that are needed. And from that assessment, once we identify the gaps in the compliance, we would then be leaving it to the local teams to then be understanding what are the safety critical, how can we prioritize, what resources do we have, and we are completely aware that there are resource constraints as well, and that may be a decision that needs to be actually taken, locally. This is also going to require good leadership, which is actually something that has also come out of the infected blood inquiry as well. And this should hopefully then lead on to the improvement plans with tangible actions, mapping the progress, having timelines, as well as accountability. And it is actually understanding, that continuous improvement is actually, is what we are really looking for. It is progress. It is not actually, the perfection that we are trying to aim for here. But also having those incremental gains and pausing and reflecting and learning from those experiences and planning ahead. And I think it is that progress, and it is also that principle of the continuous improvement that we are actually then looking for. And ultimately, making sure that we are keeping that motivation up to actually that seemingly small steps really leading on to that significant change as well. Now, as I've mentioned, the safety standards, although the standards as such were actually then released only recently, they are based on the recommendations in the previous annual SHOT reports. And remember, those recommendations came to address the gaps. So essentially what we are really doing is addressing the gaps that are actually coming through, recurrent themes in our annual SHOT reports. And these standards are really designed to create the momentum for the measurable and sustained progress. But also equally, as I mentioned, the standards go beyond the recommendations as well from the annual SHOT report. They integrate the learning from the infected blood inquiry, other national inquiries. We looked at even the reports for each of these, with Ockenden report, the white papers from the human factors on key topics. How can we use that to actually strengthen our practice and accountability? And all of these are really intended to drive real lasting improvements in care. And when we have been discussing this, I think one of the anxieties is actually that, and what we have really heard from colleagues is, it is then going to be an implementation burden, and it is again going to fall on the hospital transfusion teams. Now, this implementation is a shared responsibility. This is not intended to be an implementation burden for the transfusion teams. This is providing that framework. This is actually meant to empower, protect the transfusion teams and improve. And that is what the transfusion standards are actually then doing. And it is having that responsibility. So what we are really doing is, how do we improve? And this is a multi-pronged approach. Now, standards have come in place of recommendations, but how can we actually then improve the support for the hospital transfusion teams? And how can we have that really as an shared responsibility? So what we are really looking at is putting in as work from the 7E subgroup, the infected blood inquiry subgroup, and that has representatives from the 4 UK nations. We are looking at providing an effective transfusion governance framework. We have a current governance framework, but we have also learned that there are gaps in this governance framework. There is no appropriate resource allocation. They may be sitting in a silo and not feeding into the general safety and governance teams within the hospital, and there may not be any board oversight. So really, this framework is actually going to address all of those factors, and it is incumbent upon us to actually then ensure that these frameworks are actually then becoming a reality. So I'm hoping that through that work, by the early next year at least, we should be actually having the framework being released. But also, one of the other things that came from the infected blood inquiry was about the need to benchmark the practices and the practices across the hospitals. What are the outcomes? What are the transfusion practices? Now, as part of that, there is actually some discussions going on as well about what are the key metrics for the standards that can then be actually used to be drafted. Now, how the compliance check, now SHOT is not going to be involved in the compliance check, but how that is going to be actually monitored will be different in the different UK nations, and we can discuss that a bit more during the Q&A. So, the important thing that I really want, people to recognize is, when we champion the safety standards, we are in fact championing us, our patients, ourselves, and the quality of the care that we actually deliver. And so I would really want people to actually understand and embrace the safety standards as allies. And they are the ones which are, standards will provide us, that framework for better care, stronger voices, as well as safer systems. And this is how I think we would be turning the good intentions to lasting protection for patients as well as staff alike. So it is a journey, and we are not expecting that there would be full compliance at all the sections, but this is actually providing that necessary catalyst and the impetus for the improvements as well. Now, as I've mentioned, there are also been changes to the annual SHOT report. Now, when we look at the, if you've looked at all the chapters, now this is actually the change scheme. This is an example from one of the reports, the incorrect blood transfusion, blood component transfused. As you can see, we have that headline data, which was actually there in the previous reports as well. Key findings, and we no longer have the recommendations. What we then do is, what are the gaps that are identified through these collated reports in that category? What are the good practices that we have actually then seen in the incidents being reported, and also covering what are the next steps as well. So hopefully this has actually given an overview, but we'll also have plenty of time for question and answers as well. And the FAQ also covers quite a lot of the questions. I also wanted to actually signpost some of the upcoming events as well from SHOT. So we are having a collaborative webinar with National Comparative Audit, and that is on Tuesday, 4th of November. That QR code will take you to the events page, and you could be registering for that. We have a Meet the Expert webinar for hemolytic transfusion reactions and hemoglobinopathies that will be coming on the Friday, 14th of November. We are running our usual autumn-winter classes for human factors in transfusion. So please do join that. That is actually well, reviewed and well subscribed as well. And then we have the last Meet the Experts webinar for this year, and we are ending on a high note saying learning from excellence. So please do actually report the excellent reports to us as well. So here are the contact details, and we are also on LinkedIn, but I'll then pass on to Nikki. So thank you.
Thank you so much, Shruthi. So I'm very quickly going to give you a whistle-stop tour of how to find these resources on the SHOT website. I'll just share my screen for everybody. Hopefully you can see the SHOT website. we have redesigned this year. The whole website has been redesigned, hopefully with the aim to make it much easier to find what you're looking for. And to find the standards, if you visit the transfusion safety at the top bar, it will open this page. And on here, there's a multitude of things. We've got transfusion risks, improving safety, but over on the left-hand side, you can see the standards. So if you click on that one, and as Shruthi mentioned, we've got the scope on there. If you wanted to know the who's, the what's, the whys, why has this been developed, you can find it in the first page in that under that the scope. Here we actually have the standards, and we realise that obviously there's people work in different ways, so we have provided it in different ways as well. That everything's hyperlinked to HTML, so you can visit each of the sections. But equally, at the top, you can also see we've got a PDF version and a Word version, all to try and help people use these within their organisations to the best of your ability. If you go back to the transfusion safety standards, you can also see over on the right hand side, we've got our toolkit. This will build as we go on, but this is what we've got at the moment. We've got a timeline that, as Shruthi mentioned, that plots all the way from July from the implementation all the way through to next July over the next 12 months. We've got a frequently asked questions. There's an awful lot of information on there. Again, it's built in a way with lots of hyperlinks, so you can scroll through the document and hopefully find the answers to the questions you're looking for. We've got the baseline tool assessment that Shruthi covered in the presentation, and we've also got the most recent one is the relevant resources, which I have opened. No, I have not. I have opened here for you. It will take you through to this document, and effectively all of the standards have been mapped to any resources that we think would be helpful and any external resources. This is not exhausted. This is what we as a team have put together and what we think will be helpful. If you think there's something that we can add to this that would be brilliant, please do get in touch. We'd be more than happy to update this document. And each of the standards are listed there, and any resources that we think would be helpful. If you can't find the documents here, you can always go to our resources section. All of those documents that we've just talked about are all live in here as well. So for example, there's this safety standards relevant resources. If you can't find something, please do get in touch with the SHOT team. I would be more than happy to help signpost it. If you've got any suggestions or any future ideas, again, please do let me know. We can always discuss that as a team. So I'm hoping that was literally a whistle-stop tour. I'm going to pass over to Emma for the next section. Thank you.
Thanks very much, Nikki. We're fortunate enough to have some representatives from around the UK here today with us who are going to discuss hopefully any give examples of their approach, any reflections and any plans around implementation of the SHOT safety standards. So I'll hand over to Wales first, if that's okay. And just as you're speaking, if you could very, very quickly sort of tell us who you are and what your role is, that would be really helpful to everybody who's here today. So I'll hand over to you, the Welsh team, and Lorraine first, please.
Hi, thanks, Emma. So I'm Lorraine Lewis Prosser. I'm one of the transfusion practitioners in Aneurin Bevan University Health Board in South Wales. So I'm just going to discuss from our health board perspective. I'm here with my colleague from Quality and Patient Safety, Richard Stubbs. So from our perspective, Quality and Patient Safety, the corporate team, are representatives on our Hospital Transfusion Committee. So we've linked in with them to support with the SHOT safety standards, to support with those that are outside the remit of a transfusion practitioner. So our aim is to meet up with them as a team and work through the gap analysis. And then the QPS team are going to take forward those that sit outside of our remit. Richard now is just going to explain a little bit more about their involvement with it.
Hi everyone, I'm Richard Stubbs. I'm the risk manager in the risk management group in the medical director's quality and patient safety team here at Aneurin Bevan. And one of the things in the portfolio we have here is supporting the adoption of or implementation of NICE guidance and Health Technology Wales guidance, all Wales patient safety solutions, notices and alerts, internal audits, and the SHOT standards fall into that sort of group, so that's why we're involved with this. So what do we do when we get these sort of things? We have a sort of standardized process, although it gets tailored ad hoc for the need because they're all slightly different, which basically we take the standard or the recommendation from the audit or whatever it is, and we'll break that down into individual small separate tasks, separate facets of the thing, to enable us to work out things that are independent of each other. And what we do is for each of those we create a goal statement. So we think about, well, how would we describe the organization would look to the outside world if it fully complied with what's being asked, and then from that we'll do our gap analysis to see, well, our current status, how does that actually fit with that, what we got already, what haven't we got, and then we'll work out an action plan based on those things. And because we've broken it down to at a small level at the start of the process, it means that we can we've pretty much got independent actions that don't really overlap with each other. It makes it a lot easier to handle them and show how much you comply with and how much you don't. So once we've got these action points and we've got them underway, we'll monitor the progress of them, identify barriers, and work to achieve compliance. So the transformation framework and the toolkit sort of great help in this. Really, we haven't really got our teeth into being able to sort of get to produce our actual action plan as yet, but I think that particularly the toolkit offers a lot of extra detail to what we would normally do for sort of all comers, if you like. So I think we trying to lighten how we actually manifest the answer to this. You look at the toolkit, you think it's all very complicated, don't you? But I mean, I think we can sort of try and get a simplistic overview approach to focus where we need to work. So we're intending to do that. What's interested me is like writing the goal statements. You really have to think about, well, what is it? How do you want to look when you comply? And the standards, the SHOT standard, is pretty well broken down in individual tasks as it stands. So we haven't got a lot to do there. And sometimes these things are written as if they're goal statements anyway. So I think a lot of that side of things already done. The difficult bit is doing the actions, isn't it? And I think what you have to do is work out where in the gaps, how are they split up? Because in my perspective on things in healthcare, there are 5 main facets to the thing. There's money, expertise, information, equipment and facilities, and drugs. And pretty much those are the base factors that all these things involve. So using those as a kind of what is the dominant thing behind this barrier or whatever. If you need more resources, you need to get more expertise. You haven't got the staff with the right expertise in the organization. You can go forward to actually try and recruit them for their need. If you've got a gap in your service provision, for example, these sort of things. So we can identify these. So some barriers are very hard, some are quite easy, and the idea is to try and get the easy ones out of the way so we can concentrate on the hard ones and reach a level of compliance which is practicable.
Thank you very much,
Thanks.
Richard. That was a really good overview. Anything else from Wales? Did Rachel want to come in, or has that covered everything? Okay.
I was just going to jump back in and say we've also got a transfusion risk group in Wales, and we will monitor the SHOT standards gap analysis across the region. And there's also been a recent release of a Welsh Health circular to support high-level governance. So that's implementation of recommendations 7E, implementing the SHOT reports. And that's it from us. Thank you.
Thanks so much. If it's okay now, I'll move over to Scotland, and we should have Julie on the call, Julie Gilles. So if you could give us a quick overview of the view in Scotland, Julie, if you're there, and just a quick introduction of who you are and your role.
Yep. My name is Julie Gilles. I'm a haematology consultant for Scottish National Blood Transfusion Service, and I'm also clinical lead for the transfusion team. Just by start by saying that Scottish Government and the Scottish National Blood Transfusion Committee endorsed these SHOT standards, and there's an oversight and assurance group that is run by Scottish Government that was put in place following IBI publication, and we as part of that group formed a short life working group. Shruthi and Karen were part of that group, and on the back of the barriers that we had to implementing what was then the recommendations and now the standards, I'm delighted to say that in May a letter went out to the health boards, and subsequently in August we had a director's letter, and it was to the health boards, to the medical director, asking them to implement the SHOT standards within the health boards, that they expected there to be an executive lead in the health boards, either being the nursing director or the medical director of the health boards, that the HTCs could report to, that they expected a report on the progress of the implementation of SHOT standards by the 20th of February 2026. They also asked that a governance structure be in place so that if there were any actions that were required, it would be fed to the appropriate channels and to this executive lead. They also asked that we realise that there hasn't been a great deal of support for HTCs. It's difficult to get personnel to chair, for example, and get members involved and to attend because of competing work commitments. So the government letter also did say that one should find help, support and capacity to ensure that the HTC is able to function. From SMBTS organisational point of view, we have formed a short life working group for the SHOT standards. It has personnel from quality, lab, clinical areas and haemovigilance. We are working through our gap analysis. We've used your toolkit, and we're also doing our own resources moving forward. It's very painful this first year, but we're putting in SOPs, guidance, etc. as resource and reference to. We're planning to complete that and report to our clinical governance safety group in November 2025. Looking at this, we are compliant with all but 2. So I think we're doing very well. From a point of view of the health boards, we have asked the transfusion practitioners to ensure that the SHOT standards are a standing item on the agenda. We've also circulated the toolkit that is there for assessment for the transfusion practitioners to utilise or to give to the health boards to utilise in looking for their gaps and help with the implementation. In addition to that, we have for the first time a patient safety officer being appointed in Scotland. So it's just early days in that appointment, but I think that's a positive move. In terms of public and patient engagement, we've been working quite hard with alliance groups to try and get patient and public engagement into our SMBTS forum and a wider forum. We've been doing patient information leaflets on a 4-nation basis with the UK and Ireland Blood Transfusion Network, and certainly there's QR codes to My Transfusion app for patients on the patient information leaflets on receiving a transfusion. We're also promoting My Transfusion apps to engage the public, and I've had requests to send out additional information for haematology clinics and waiting rooms, and I've been doing that. So I think that's a little bit of a summary. We've also set up a benchmarking SHOT life working group, and we've had some funding for our Account for Blood, which is our clinical dashboard, to look at clinical transfusions and trying to outcome them. So I think that's the progress in Scotland to date.
Thanks so much, Julie. Sounds like there's some great engagement and you've seized the opportunity there in Scotland post IBI. Thank you. So we'll move over to the Northern Ireland view now. So we've got Damien. Damien, for those who perhaps didn't join at the beginning, if you just quickly give your name and your role, and then an update from Northern Ireland, please.
Thanks, Emma. Yeah, I just caught the beginning. Yes, hello everyone. I'm Damien Carson. I'm a consultant anaesthetist, and I'm the audit and implementation lead in the Northern Ireland Transfusion Committee. And just to reaffirm again that the Northern Ireland Transfusion Committee have fully endorsed the new SHOT standards. We think that by defining measurable expectations in the area of transfusion creates an excellent, comprehensive and definitive text for transfusion teams to both apply leverage and measure against their trusts to achieve this ongoing improvement. We've not, like Scotland, worked out our higher reporting mechanisms, but we do tend to try and coordinate all these new regional initiatives. And the NITC officers and our regional human vigilance coordinator, we carried out a review of the assessment tool and marking where we see our trusts against the tool and how it might be used. And we did like the assessment tool and the way it breaks down the 8 sections and the sub-criteria. And I suppose we had 3 comments to make on the assessment tool. One, we thought in Northern Ireland that we'd break down the tool. The tool breaks it down into 8 sections, and each of the sections has sub-criteria. But the criteria are somewhat bundled, and we thought we would break each of them down into single criteria in terms of marking, just to make it easier. For example, in consent, it could be broken down into just individual parts of documentation. Is consent documented? Is there evidence that patient information was provided, and was the patient informed who no longer could be a donor? That each of these would be broken down into separate parts rather than to have them all together. And the additional breakdown, we work in improvement, and the additional breakdown makes the criteria easier to see precisely where that improvement is needed. And because we find it's more motivating to see progress being achieved, whereas if you have 6 or 7 subsections in a single criteria for marking, you find that it can all be lost in that single grade of partial compliance. And the second area that we thought that we would take the baseline assessment and maybe just make a small modification is that there should be, we'd offer some local guidance and a minimum baseline score for partial compliance. So we would probably start at about 60 to 70%. Below that, that's non-compliant, and then have a grading system through partial compliance, from being low partial, moderate partial, and high partial. We find in previous audits that full compliance or 100% can be exceptionally difficult to achieve, and if you've got a number of subsections in it, can be impossible. So it's really good to understand what level of partial compliance you're at, whether it be 70, 80, or 90% that you actually have. That's much more motivating for people to actually address the subject and try to improve it. And finally, I think we're currently undergoing major digital transformation in Northern Ireland. We have a new LIMS system in all our labs that has come in that's linked. We have a new electronic health system from Epic that the last of our 2 trusts have just completed, and it's all linked. And we're in the process of an impending digital traceability system from Haemonetics. And our job really on the ground is to try and link these 3 systems. We see the future really to have many of the metrics automated within these systems for our teams on the ground. So that's about it. Overall, we really like the model of the standards and the continuous assessment and the potential leverage it brings to the transfusion teams to improve transfusion standards. Obviously, more resources will be needed in the ground to improve, but we think that this is really a very big step forward to help us to improve. Thanks very much, Emma.
Thanks so much, Damien. That's great. And we really welcome the feedback on the baseline assessment tool. It's good to hear how you're adapting it locally as well. And as you said, all this is going on among a huge IT project countrywide. So absolutely. Fantastic. And finally, the England view, we've got Jenifer Davies with us, who's had, we know she's had some pesky IT bugs, but to give the England view, if that's okay, Jenny.
Yes, thank you. I'm sorry for being late to the meeting.
Oh, no worries.
So I'm just going to talk from the perspective from our trust. So I work in the North Devon and the Royal Devon and Exeter hospitals under a single trust. I'm just going to explain how we approached the SHOT standards and how we approach generally national audits and any kind of recommendations that come through. So we always start off with the gap analysis tool, which is really helpful when it's provided for you and you don't have to make it yourself. And we complete that, first of all, from the hospital transfusion team, where we know exactly where we're compliant or non-compliant for all of the aspects that are under our remit. And then in our organisation, we're lucky enough to have a fantastic governance lead called Laura, who covers our pathology as well as other areas. So once we've done our gap analysis from the hospital transfusion team, I then send it to Laura and she distributes it to all the other relevant areas that are outside the transfusion control, and that goes through their governance groups. And then Laura collates all of that information into the gap analysis, sends it back to me, and then we create a short report on that goes to the Trust Clinical Effectiveness Committee. And this report mainly talks about the areas of non-conformances, and we have to provide an action plan within that report with who's responsible, timeframes, etc. And once that's been approved through that committee, then we will put those actions onto Datix, which is our instant reporting system, as individual actions assigned to people with the target dates. And then those actions are reviewed by the relevant governance groups. And also Datix provides reminders if your action goes overdue. So you have to sort of explain if you're going overdue with any of your actions. And we'll also add anything to the risk register if it's not already on there, but it is identified as part of the gap analysis. That will go on to the risk register as well. So it's picked up at that level. And that's how we are approaching this. We're only partway through the process with the SHOT standards at the moment. They've got to have their report written. But that's the approach that we take with everything, which seems to work quite well for us.
It's really interesting. Thanks, Jane. It sounds like there's been great strides considering they only got released in July and a very robust kind of risk system going on there. We do have a bit of time for some questions which we've been receiving. So if I could put those to the whole panel, see who wants to answer them. The first one is regarding the baseline assessment tool. So do organisations have to use it, and does it need to be returned to SHOT? You're taking that, Shruthi? Okay.
Yeah. Sorry, I raised my hand rather than actually raising the hand on the Teams.
Nice.
But no, thank you. And I think the baseline assessment tool, like with our gap analysis tools that we were giving in the previous and with the annual SHOT reports, is only a template. And I think we've heard different views. It is not. You don't need to return it to SHOT. It is actually only to actually facilitate teams at the hospital to actually then as a starting point. And you could use that, or you could actually then, have your own local template as well. So the answer is actually very simple. If it is useful, and if that is actually then reducing that effort to actually build another gap analysis, like Jenny said in her hospital, then please do use it. You don't need to return it to us. It is only as that starting point to guide your next step within the hospital.
Thank you, Shruthi. Damien, go ahead.
Yeah, and once again, I would just reiterate that it can be quite useful to break down those standards that are a little bit bundled into smaller pieces locally. It just will be much easier to mark and to. I don't know whether SHOT will plan to centrally give us compliance criteria as to what where partial starts. Does it start at 70% or 60%? Or does there's no sense in it starting at 1%. It's got to be a certain standard to even meet partial, and so we will probably have something locally until perhaps we get central guidance from SHOT. But I would certainly advise, breaking it down a little bit more.
Yeah, thank you, Damien. And I think I completely agree. So the difficulty for us was actually, when we say partial compliance, depending on what the ask is, it is, what is considered as safe. So we can't be actually, and there may also be a degree of subjectivity when somebody says this is 70% or 80% compliance. And that's the reason when we actually gave it, it was at a high level. Now we are happy, and if anybody has a gap analysis tool or something that they have actually broken it down to and defined the criteria, happy to signpost that on the SHOT website as well. And it is these discussions that would actually then help us see how can we do this better, and provide the resources which are more meaningful as well. But Richard, I think you may have some other idea as well, so please do come in.
Yeah, well, I'm totally with Damien on this in terms of breaking things down, because that's what we found is that's the best way of dealing with it. And I think there may be sort of more overarching ways you can break it down that apply to everybody, but some of them will be specific to your organization and how it's structured and all that. But I think it would be useful if we could actually share as a group what we're breaking things down to, because as I said when I was talking earlier, if that can be reflected back into the standards are revised, it means that you can actually break down what it's really asking for in the first place to match what the underlying breakdown actually is, I think, perhaps.
Yeah, no, thank you, Richard. And yeah, I think it's always that small chunks and incremental way, but yeah, we could actually look into that. Thank you.
Thank you. So this next question is, do we have to comply with all of the standards, or are some not appropriate for my area, such as outpatients?
Yeah, and I think it is, I think I can also combine it with the next question as to who the standards are relevant to as well. I was just seeing that because both actually run together. Again, others in the team, please do come in as well. Now, this is primarily for anywhere where the transfusions actually happen. Now, whether it is in the inpatient setting or ambulatory transfusions or in the community as well. But I think depending on what aspect of the transfusion practice, now this would be locally that you would then be determining. So as I said, the standards cover a variety of things at the system level, and it covers both the clinical as well as the laboratory. And therefore, I think it is then discussions within the local team to actually then say, I can't tease out and say this is not applicable. If outpatient setting transfusions are happening, again, how are we actually in training our staff, having adequate staff, having the IT systems to support it, patient education and patient partnering, all of these will then become really important as well.
Thank you, Shruthi. I think there's a couple of questions which are along the same theme, really. So there was a comment that after Jenny's talk that's really good, but it's still the TP that's doing all the chasing in their particular trust. So will the responsibility fall on transfusion teams to implement the standards? I think that's a burning question that's a lot of people want answering.
Yeah, no, thank you. And I think it is, it is an important one, and we are, really advocating for the transfusion teams to get more support as well. So as I said, even in my presentation, this is not meant to be an implementation burden, but a shared responsibility. But what we are trying to do, and how can we actually, address that gap, is, I think, as I mentioned, with the effective transfusion governance. So we are really actually then hoping that this is a multi-pronged approach. So when we have that effective governance and having, you have heard the different models across the UK as well, we would then be actually ensuring that there is adequate support for the hospital transfusion team with that oversight as well. So, that hopefully would be actually then coming in the next few months. Now, what we are also trying to resolve is who is going to ensure the effectiveness of that governance structure. So we will need to actually then work, and we are working as part of that IBI subgroup discussions. We are actually then discussing that more and more.
There's a hand up. Sorry, can't see who it is.
I'm not sure if they'll be able to unmute, actually. If you could put that question in if you could type it in the Q&A, that would be really helpful. Thank you. And then hopefully we can get to it.
Yeah, thank you. The next question is, what does the timeline look like for compliance in terms of monitoring by the regulators from your SHOT's perspective? Am I right in assuming that it will be the MHRA CQC in terms of regulatory scope?
Yeah. Thank you, Sasha. And I think this is, again, a work in progress. Now, MHRA's remit as the competent authority will only be mainly for the BSQR, that is the blood safety quality regulations. But here, again, with that monitoring and oversight, which again was part of that infected blood inquiry recommendation, is going to be different. How that will look like is different across the UK. Now, in England, we are having some discussions with the CQC. And as I mentioned, again, how is that metric going to be actually decided, the compliance check or the status with the standards. Now that would be decided in conjunction with the benchmarking group, and we are then having the discussions with the CQC. When will that begin? Because we already know that the CQC are also actually then revising the way and revamping the way they would be actually doing the hospital assessments. So this is an ongoing process when they would be actually incorporating. So now at present, other than the safety alerts that are issued, the transfusion practices and processes are really not examined in that great detail, to my knowledge, with the CQC. So we are hoping that in England it would be the CQC. Similar, in different nations, we have heard how that oversight mechanism, like Julie mentioned, in Scotland, there is actually a different oversight group. There is the Blood Health National Oversight Group in Wales. Again, that is actually in discussion. And again, Northern Ireland, there would be a different oversight. So across the UK, that oversight, which is again a follow-on from the IBI, the Infected Blood Inquiry recommendation, that is going to be slightly different. I don't know if any of my colleagues and the representatives from the UK nations would like to say anything as well in response to this. Julie.
Thanks, Shruthi. We've been very fortunate because of your and Karen's involvement in the SHOT Life Working Group for the IBI to get Scottish Government to give this sort of request, and they are taking a sort of light touch to see what the health boards are doing to implement the SHOT standards, and we're expected to report by February 2026. So I think they haven't given us the detail of what happens if we haven't implemented them, and I think that's going to be crucial, and how they propose to take things forward with various health boards, because I think each health board in Scotland is going to have different issues in the implementation of these standards, and it's not a one-size-fits-all. I know we've got a once approach for Scotland, but I think the issues in implementing the standards will vary from health board to health board. But we are fortunate that they have agreed to do this in February, but it's thereon after, and it's also the devil in the detail about what happens if health boards are not implementing it. But that's just my insight about Scotland.
And I think Rachel, please do come in, Rachel.
Hi there. Sorry, my camera seems to be playing up. It's not letting me try again, but oh, there we go. Sorry. Yeah, so we have the transfusion risk group that sits under the BHNOG within Wales that has got representation from all of the health boards and the risk pool from Welsh Government, and then that reports up to the BHNOG. And as part of that group, the Welsh Government has issued the Welsh Health Circular. So that's outlining what they expect from the health boards to get from a governance level. So we're trying to get that higher level governance for the transfusion laboratories, because what we found in the past is that a lot of the HTCs aren't getting the governance higher up than themselves. So they're quite restricted on completing the recommendations. So that's gone out, and they're expecting a reply to that by the 28th of November. And they even want to see some of the initial findings, proposed actions from the baseline assessment by the end of December. Thank you.
Thank you all for your participation. We have now run out of time for questions. If you have any outstanding or urgent queries that were not addressed during this session, please feel free to email them to shot@nhspt.nhs.uk. Just to let you know, SHOT also aims to update FAQ document in the next couple of months and will be uploaded on the SHOT website on due course. So sharing your questions with SHOT will help us shape this document. So I just want to say thank you to all speakers for their excellent presentations, and to everyone who contributed with your questions. We'll now launch a brief poll for all attendees. It should come in your screen. Your feedback is greatly appreciated as it helps us to improve future webinars. As you have your poll on your screen, please note, as has been mentioned in the beginning, that there is no certificate for this session. However, you may use your reflective practice document or equivalent to record this webinar as a CPD activity. Also, as has been mentioned, please visit the events page on the SHOT website, where you will find all the upcoming webinars. We are just going to leave the poll open for another minute, so you have time to answer. Just to say, once you complete, just don't forget to click submit in the end. So the poll is now closed. I would like to thank you all for joining us today, and I hope you have found this session useful. We'll now close the webinar, and we hope to see you at the next one. And thank you very much for attending. Really appreciate it.
Yeah.